Describing a picture in medical school interviews. What should I expect? How do I make my answers concise? And what are they actually looking for? By the end of this video, I'll show you how to tackle this type of station. Hi, I'm Shivam from MedicMind. My students find this type of question really difficult and don't actually understand why they need to answer it in the first place. I'll be going through a step-by-step approach as to how to answer this question and get full marks in the medical school interview. If you want to watch more videos on medical school interview tips and tricks and techniques, then subscribe and hit the bell notification. So, how does this station work? Well, you'll be given an image or an object and asked to describe it to someone who cannot see it. So this type of question is asked very frequently in MMI interviews, for example at King's and Manchester. So why do they ask this type of question? Well, the reason for that is because if you're in a hospital and say, for example, you had an X-ray in front of you and your colleague was in another part of the hospital and you needed to describe this X-ray to someone else, you need to do it in an efficient and cohesive way. Therefore, this station is testing your communication and observation skills. And finally, it's there to chuck you in the deep end and get you out of your comfort zone because it is a difficult station. So this type of question can come in many different forms. For example, can you describe an image to someone who cannot see it? Or can you describe an image to someone who is blind and needs to draw it out for you? They may also give you an image and then ask you to describe it and then analyze it. For example, they might give you a picture of a crew in an aeroplane and then ask you to expand on why teamwork is important. So here's an example of a station. Pause the video and have a go yourself. So for these types of questions, you have to start off with the very simple observations, set the scene for the interviewer, tell them what do you see in front of you generally or overall, what is the setting, where is this image, can you give any more information about the date or time of this image as well. So this is an image of a high street during the day with people queuing up to go into Primark. Now, we don't know if it's summer or winter, but we can assume that it might be summer because some people are wearing t-shirts. Now you need to describe to the interviewer the main features of this image. So the main features of this image is that you can see a large group of people, around 20, socially distancing whilst trying to get into Primark. Now again, mention small details like the fact that there are marked outlines on the ground and the fact that there are bollards as well separating the queues. So now you want to move on to the minor or finer details of the image. Now this is where you can use your creative flair to pick up on very small points that other people might not talk about. So for this image, I can see that some members of the public aren't actually socially distancing and some are wearing masks whilst others aren't. Now, in the picture, I think I can also see someone who is standing by the door, so that might be someone who's guiding people into the store, making sure that there are a certain number of people in the store at once. And also there's a blue sign there, maybe telling members of the public to adhere to social distancing rules. Now, another small point that might be quite unique to your answer is that you can say that perhaps this is a new high street because the pavements and slabbings look quite new relative to the rest of the high street. Again, think of something unique. Think of something that is individual to yourself. So at the end, you need to summarize and discuss this image. So maybe tell the interviewer, what is the take-home point from this image? What's the overall picture telling you about this situation? The image that I've shown is quite complicated and there's lots going on. So just take it step by step. Think about the overall picture and then look into the fine details, even things very basic like the glass or mug that someone is holding and seeing whether it is Christmas related or it's in the morning or nighttime. So overall, this image has shown us that people are adopting social distancing rules and that the shops are actually ensuring that this is taking place. It also shows that some people aren't still adhering to wearing masks. And finally, the high street looks relatively empty compared to this store. And just to finish, let's go through some things that you maybe shouldn't do when answering this question. Firstly, don't be too specific too early on. For example, in the image, you wouldn't go on to describe very particular things about individual people in this setting. You just want to give a very simple overview of what you can see in front of you. My next tip is to try not to make assumptions. You can infer that something may potentially be happening, so try to use phrases like maybe, potentially, and could be. So you could say that the rest of the high street doesn't look relatively busy, which could potentially show the impact of COVID. But again, we don't know what specific time of the day it is, like 9 a.m. in the morning, so don't assume too much. My final tip is to describe the image. Don't spend too much time explaining what the image shows, just describe it. Describe what you can see, and a really helpful tip is to think about describing this to someone who is completely blind and cannot see the image in front of them, and the fact that they have to actually draw this image out as well. So try your best to describe what you can see and keep it simple. I hope you found this systematic approach useful. Remember, this is something that's going to be very important in medical school and when you become a doctor. For example, if you're explaining an X-ray to your colleagues, you start off with the overall picture in front of you, you explain some of the basic things you can see, then you go on to the minor details that you can see, and then finally you might give an inference or might explain why this is happening. So there you go. Try to follow this systematic approach when describing questions in your medical school interview, and it doesn't matter what type of question they throw at you, if you use this technique, you'll be able to ace your answer. Thank you so much for watching, and best of luck for your interview. Thanks for watching this video. Click below to subscribe and catch more of our videos. To watch our full online course and find out how you can enroll onto our award-winning program with personalised one-to-one tutoring, online weekly webinars and more, click here.